In the chaotic wilds of the American healthcare system, most humans struggle daily. Frazzled, frustrated, confused. Observe the traditional insurance user, a once dominant species, now dwindling in numbers, clueless, trapped within a caged network with endless paperwork and mysterious billing codes. But on the horizon emerges a rare and remarkable sighting, the Apta Guardianship member. Unlike their insurance-dependent cousins, this fascinating creature pays cash for healthcare. No balance billing, no surprises. Thanks to pre-negotiated rates, they pay nothing out of pocket. And with direct access to primary care providers, also at no cost, they roam free, unburdened and thriving. The Apta Guardianship member evolved, adapted, making all other healthcare programs seem like an ancient relic. Apta Guardianship, the final evolution of healthcare.